Next up, Stacey Ulacia, Senior Communication Specialist, Seattle Children's Hospital.
Hi, I'm Stacey. I'm a Seattleite, and I've been working on the digital health team at Seattle Children's for about 4 years. But prior to that, I actually worked at Amazon on their device marketing and advertising team. And the last product I was read in on was Echo. And as funny as it may seem now, we spent weeks trying to figure out how to market it as something other than just a device that could only play music. So you could say I've been an early adopter of the technology, but I'm also a mom to 2 really young kids, so pediatrics and public health is important to me. So we set out to create an Alexa skill to build trust in the science and safety behind the flu vaccine. So using our skill Flu Doctor, you can find where you can get the closest flu shot, who should get it, when you should get it, what common side effects there are. And we know the flu vaccine is an essential every-year vaccine for everyone 6 months of age and up, but we don't do a good enough job vaccinating against it. Last year in my home state of Washington, we had an overall pediatric flu vaccination rate of about 57%. So we can be doing better, and so that was sort of the hope and mission behind Flu Doctor. This was really a handshake across the country between 2 leading children's hospitals, Seattle and Boston. And we had common shared goals of improving pediatric health, hopefully increasing flu vaccine rates, and all the while being able to tinker in the innovation space. So on the Seattle side, we had the trusted voice of Dr. Wendy Sue Swanson. She writes the Seattle Mama Doc blog. She's also been a flu spokesperson for years, and she's the chief of digital innovation at Children's. And we knew we could take learned strategies from our digital channels we're already using, Facebook, Twitter, Instagram, a weekly podcast, and apply those to Alexa. On the Boston side, they're obviously world-renowned for their innovation, and they led the back-end dev build of the skill along with the technical project management, and we knew they could guide us and teach us based on products they already have in the market, like KidsMD. So skill discovery, I think we can all acknowledge that this is really hard. Users don't necessarily understand how to go and find and enable skills. So we set out to create a step-by-step infographic really outlining that you have to open your phone, open the app, drive all the way down to get your skill enabled. And then we created a really short demo video that we posted on YouTube and also the Seattle Mama Doc blog. And we used both of these pieces when we were pitching to national media to teach them about the skill. Thanks to Dr. John Brownstein, we were able to embed Vaccine Finder in our skill. It's an amazing existing technology that we had at our fingertips, and we knew we could use it to power and personalize our skill even more. So when you're using Flu Doctor, you can ask her where the top 3 closest clinics, pharmacies, grocery stores that carry flu vaccine are based on your zip code. And you can either tell her your zip code or you can give her permission on the back end of the skill. The content of our skill was really built on science and data and expertise. Dr. Swanson wrote the scripts for both the Alexa responses and her responses to user questions about flu. And then we vetted those scripts with national organizations like the CDC, the American Academy of Pediatrics, a vaccine expert at CHOP, and our Washington State Department of Health. So they all reviewed the content, approved it, gave us feedback, and then because that they were so invested and involved and aligned, they helped us promote it. So how would we get users to know about our skill? We knew we needed a launch plan that would be a combination of earned media, social media, and a launch platform. So we launched the skill around the 2018 NFID press conference that takes place at the National Press Club in Washington, D.C. And Dr. Swanson was asked to keynote that event, and because they were so enthusiastic and supportive of our skill, they let her announce it there. And then we also actively pitched media and secured placements in outlets like GeekWire and the Washington Post. Now that our skill's out there in the wild, we have 3 basic tips. Number 1, make it personalized. We don't have any data to back this up yet, but we suspect that our users are going to be more engaged and more trusting of our skill because we didn't just use Alexa's voice, we used Dr. Swanson's voice as well. Optimize for show. Video content is king. If you don't use it for show, you can use the video elsewhere. Be inclusive, involve everyone so your skill feels really co-championed. And the future state of our skill, we hope to implement notifications and reminders for families when vaccines are due, and not just when they're due, but why it's really important. We'll be providing weekly updates, letting you know how flu season is faring based on CDC surveillance data, and we'll be opening up an editorial calendar to feature other flu experts and their voices within our skill. So follow along. enable Flu Doctor and let us know what you think.